Marilyn again, and Transcultural Caring Dynamics in Nursing and Healthcare. And we looked at the model and all the different dimensions of the model. And now I'd like to talk to you a little bit about an assessment tool. And this is a cultural assessment tool that where within the context of that assessment tool, often there can be different conflicts. So what I'd like to do is, it looks like a busy model, and it is a busy model, but these are some elements that help us become more aware of what often becomes conflict within our relationships with people of different cultures, or maybe even understanding our own selves and our own culture and our own family, and also to really begin to understand the context again, or the historical context that we all live in at this time. So this model has all these different elements to it, and so I'll talk about the first one, which we talked about a little bit before when I shared about my theoretical model. But we're looking again, when people whom we're relating with might come from different culture histories, which is different ideologies or belief systems and different religions. So, and that could mean even people whom we work with. You know, we are now working with many professional nurses who are coming from different cultures, who might have some different backgrounds that we don't have. And so trying to understand these belief systems, or what it was called ideologies, or religions. For example, if we were working with a nurse who was of the Muslim culture, Islamic faith, and so there's a mandate within the religion to pray 5 times a day. So then we would have to negotiate with each other to begin to understand how we can facilitate and help one of the nurses, or our nurses, if they have this belief, how they can have time out for prayer. And then again, also if we were caring for a patient, and how we would care for them within these different religions. If we had a Catholic patient, and we had a patient who wanted to say his or her rosary, and we would have to find a way that they had quiet time to be able to do that. So if we don't, we could maybe have conflict. So this is an assessment tool that helps us understand ideologies and religions that are diverse or different. And so one of the major things too, and especially those of us that live in South Florida, we have people who may not be English speaking, and we may not be fluent in Spanish or Creole. And so we have to be aware of what potentially we have to do to help people to be able to communicate what their health needs are. And there is also generally in our modern hospitals, we have opportunity for interpreters. Now sometimes we can use a family member as an interpreter, but from a professional point of view, you know, this might cause some difficulties if the family member is interpreting within the framework of their own self, and might not be expressing the needs of the patient as well. So if we don't understand a patient and their language, it is important for us to seek a way that we can communicate more adequately. And again, we also have the technical language that we're working with, and in our modern hospitals, we have to be aware of what those technologies either provide maybe different conflicts. Like today in a 12-hour duty, sometimes a nurse is on the computer for 4 hours of that 12-hour shift, or sometimes even greater. So we have to be aware of how do we integrate this technology into our nursing care, but at the same time not let it take over everything that we do. And so that becomes a very great part of our communication in today's world in our modern hospitals. And then if we're in nation states that don't have technologies, then how do we adequately communicate so that the best provision of care can be provided? Like right now with Hurricane Matthew that hit Haiti, it is an enormous healthcare issue there. We even have old-fashioned diseases such as cholera, that are showing up. So we have to be aware of how these kinds of things can impact health and healthcare. And again, as I talked about before, was social media and how social media is impacting us, and maybe we're trying to find ways to have more knowledge about a particular disease process or something, and we might go on social media or the internet, to try to find out what protocol might be established so that we might be able to care better. And sometimes physicians get critiqued because oftentimes they might go on a computer to see what protocol has already been established for a particular illness or disease, and as a consequence they might not be listening to the patient. So we have to be open to what these communication systems are. The other one I spoke a lot about in the model, which was looking at diverse cultural rituals and how they play a role in meaning of health. So if a patient has a different ritual that we don't understand, it's important for us again to communicate about those cultural rituals, and even our own, that we might maybe have but don't often recognize. But it can cause some types of conflict sometimes. And again, in the model of looking at different symbols and meaning of reality and health, care, and caring. So each of us, again, comes from a particular value system, and so that value system impacts our meaning system, or what something means to us in terms of health and health care, as well as caring. So as long as we can recognize that there is a potential for conflict there, but we're aware of it, and one of the most important things I think often is reflecting on ourselves, and then we can begin to see how we might be different from other people whom we work with, and if we work with people of different cultures, and how we are more open and understanding about the nature of our relationships. And then we have, again, differences in gender. So we have differences that, and also in race. And, we've had a hard time sometimes, and even in the discipline of anthropology, talking about race, but we have racial differences, and often sometimes they can cause conflict. But we as nurses need to be open to these differences, and also differences in gender, and also including the LGBT community and what that means also within the context of doing good, excellent transcultural caring. We may have intergenerational conflict, and this is not an easy notion, because in our institutions, we may have nurses who are as old as I am working, who are of a different generation, and then we have young nurses. So there may be this kind of, this is what they say today in our hospitals, that, the young nurses are very cognizant about social media and internet and computer knowledge, and we older folks, we don't have that particular, we might have the knowledge but not the particular expertise. So that can open us up to some kind of intergenerational conflict. And we might see that with our patients and family members. There's differences in the generations when they're trying to come to some understanding about a person's health or future, if they have to go to a nursing home or assisted living facility or a rehab center or something of that sort. And then again, the social environment or the social class. I mean, it's hard to say that in our culture we have class structure, but we definitely do. And sometimes we don't treat people the same way if they might be from the culture of poverty or the opposite, which would be the culture of wealth. So we have to be aware of what the potential conflicts might be within that idea of social class and the social environment. Sometimes we're fearful. We might be professionally fearful sometimes if we don't particularly understand a particular patient whom we've been assigned or been part of our day's work, and we might not be able to, understand through fear. So this just helps us see that that's a possibility. And then the three areas that are difficult in our understanding of transcultural nursing is prejudice. The idea of prejudice or prejudgment is a natural part of us. We prejudge because we come from a historical background, a professional knowledge background. So the way that we make decisions is by judging something. But we have to be careful when we might prejudge too quickly, especially when we're relating to somebody else who's different from us. So prejudice, is a potential for conflict. The other is stereotyping. Oh, and we do this a lot in nursing. We might have somebody who repeats, maybe coming into the emergency department, and so we might call them a frequent flyer. And so we begin to stereotype people, or rather than say a person's name who's in a particular room in a hospital, we might call it a number, 252 or something, rather than actually responding to the fact that there's a human being in that room. So we have to be careful about stereotyping, and certainly within the notion of race or different ethnic groups, people we work with or people we care for, we just have to recognize that this is something that we might do, and we have to control it somewhat. The other is ethnocentricity. Sometimes we might think that our ethnicity is more dominant than the other. So as a result, we have to be very open to being potentially ethnocentric, which can cause conflict. The idea of marginality, the idea that we can marginalize somebody or keep them on the edge, or sometimes people are from two different cultures, trying to understand the meaning of what that is within two different cultures. Our system of government legislates certain things. So for example, we have the Affordable Care Act now. So we need to be aware of what that means within the notion of healthcare reform, and also the problems that exist as we're moving forward to understand all of the processes associated with this type of legislation. And then we have different models of care. We have, in our culture, we have what is considered maybe more a medical model or a Western model. And when you go to the East, you have an Eastern model of healthcare. And then again, I talked at large about economic resources and those problems. And then of course in nursing, we have a lot of time problems. People say, well, I don't have enough time to do transcultural nursing because I don't have enough time in the day. But if we are more aware of it, we can be open, to having the time to provide transcultural nursing. And so this model, it can help us to see what potential conflict arises when we are working with our patients or working with each other as nurses, or trying to understand the institutional administrative system, in our healthcare system, or institutional care systems. So this just gives us an opening to what potential conflict might arise.